Hello, my name is Alison Karim. I am talking about the triple CFTR modulation therapy or systemic fibrosis. Definition: Systemic fibrosis is a more frequently autosomal recessive disease causing and is causing a mutation in the gene that encoded the transmembrane conductor regulation protein CFTR.
Inside your lungs, you have the bronchial tree. This carries airflow back and forth. In people with CF, the lungs contain long, thick and sticky strands of sputum. This clogs your lungs and becomes an ideal home for bugs. Dornase alpha, also called DNase and pulmozyme, helps you to get rid of the sputum. When taken regularly, DNase will chop up the thick strands of sputum into smaller pieces, making it easier for your lungs to clear. DNase is a subtle helper. It doesn't make you cough a lot, and you probably won't feel any immediate difference, but throughout the day, you'll be clearing and swallowing small amounts of sputum as your body moves it away from your lungs into your mouth. Over time, this helps to keep your lungs healthy and protect your lung function. If you don't take your DNase regularly, then the amount of sticky sputum may increase and become too much for the treatment to clear properly. If sputum sits there, then infections are more likely, and that can result in damage to your lungs. So remember, you may not feel DNase working, but it's doing its job.
Application in medicine. The transmembrane conductor regulation protein regulation the presence of chlorina's sarin water in the epithelial cell is a diagram led to anomaly in transport of ions so that patient produce a thick and viscous motion with a structure that though of the organ where its location.
A patient with cystic fibrosis is susceptible to infections of the lungs. This is due to a mutation that affects a protein on the surface of lung cells. Many different mutations can cause cystic fibrosis, but all of them involve a transmembrane protein called CFTR that functions as a channel for chloride to move in and out of cells. In this case, CFTR is less able to transfer chloride ions out of the cell compared to the functioning protein in people without cystic fibrosis. The channel is, in effect, locked shut. This inability to transfer chloride ions has an effect on the outside of the cell. In people without cystic fibrosis, there is a balance of chloride ions inside and outside lung cells, which maintains the right amount of water and salt ions in the mucus lining the airways. Cilia normally sweep the watery mucus from the lung lining, keeping the surface clean. In patients with cystic fibrosis, chloride ions concentrate inside cells and draw in water by osmosis. With less water, the mucus becomes thicker and cilia can't move. Flow is reduced, providing an environment for bacterial infection. But there are now drugs that can help patients. To find a drug, researchers tested over 200,000 small molecules to see if any would bind to the CFTR protein. Then, for each small molecule that had some binding ability, researchers chemically synthesized different variations of that molecule and tested them for the ability to improve the function of some types of mutant CFTR channels. They identified a drug that, when taken by patients with a certain type of CFTR mutation, binds to the CFTR protein, opening the channel and allowing improved ion transfer. This increases chloride ion flow and maintains a watery, clear mucus, which helps the cilia move more freely and reduces the risk of bacterial infection.
People have better quality of life, living more than 14 years old, something that was impossible before. Cons, it's like dark eyes they are having result of their new molecule. Is necessary a molecular combination which is according to the mutation or existing in each patient. Issues in its application in medicine. It is an accident of 1 per 5,000 and 6,000. New word depending of the region and the ethnic origin. Conclusion: fibrosis is an autosomal recessive monogenic disease. Is an example of what could be a well-situated disease to be benefits from personalized medicines. And now, thank you for your attention.